first thing to do when a patient is diagnosed is I tell that patient, this is a scary moment, we understand that, to take a deep breath. I think they should strongly consider going to the Mayo Clinic website. We have an amazing amount of information on the Mayo Clinic website. And if they feel so inclined, to reach out to us, because it's very easy to do. And then from there, we can work with the patients to see if actually coming to Mayo Clinic makes the most sense for them.
Patients and families should seek care at Mayo for a number of reasons. The data is very compelling that centers that treat a high volume of tumors have better outcomes. That's everything from cure rates to complication rates, so fewer complications from the surgical perspective, from the medical perspective, from radiation perspectives. Ideally, if you're able, the data is pretty compelling that the outcomes are going to be better if you can seek volume at a place that has a lot of experience with treating these brain tumors. I tell patients, even that have come here first, that I never have any problem with patients seeking a second opinion. I think it's always a good idea, especially for rare conditions, to seek a second opinion. A lot of times it's not because what you've heard before is wrong, but in medicine, which is a science, there's still a lot of judgment. Two people can look at the exact same information, a cure rate and a complication rate for a particular surgical procedure, and one person will say it's worth it, and one person will say it's not. In the ideal situation, the families would hear both of those choices and have the opportunity to weigh in to the decision making, to be able to decide, is this the right thing for me? Is radiation right? Is surgery correct? Is chemotherapy the best?
It's always challenging when patients have to decide what type of treatment is best for them. And that's why at Mayo Clinic, they don't have to make that decision alone.
At Mayo Clinic, we frequently meet together as a multidisciplinary group, and as a result, we have many opportunities to make sure that we are treating in an integrated manner and that our patients are receiving the best care they can. We are blessed by having world-leading experts in virtually every area of medicine, and as a result, it's very easy to obtain opinions between ourselves. And also, the culture of Mayo Clinic is such that we really encourage close communication, which means that all of our patients will benefit from that collegial environment. I think some of the factors for patients when they're trying to decide where and how to be treated have to include their own personal circumstances. So it isn't always in their best interests to be treated hundreds of miles or hours away from their loved ones and from their support network. And under those circumstances, we would often want to do our best to try and provide them and their local providers with appropriate support so that they can be treated closer to home. There are certainly tumors that are uncommon where specialized expertise is required in order to try and optimize their outcomes. And under those circumstances, those patients really do benefit from being referred to a tertiary care facility where there are specialists and subspecialists who can best address their particular situation and provide them with the best chance at a good outcome.
I have a burning desire to try to make things better, and here at Mayo I'm able to do that. I'm actually able to use the experience that I've had to design clinical trials, studies that I think will actually make a difference for the future based on my experience with the patients, and that's true of all the staff here.